Hi, I'm Dr. Lisa Ng, and thank you for visiting our site today. I started in 1995 when I graduated from Lutheran Medical Center in Brooklyn. We're in private practice. We've been in as many as 4 counties in New York City. We're now just located in Manhattan and in Brooklyn, and we're soon to open a birthing center, if we're lucky, hopefully in Bay Ridge. I have a partner, a junior associate, and a midwife as well. I didn't come to this country to go into obstetrics and gynecology and slave for 13 years so that I could work for a hospital. I like being my own man, woman, as it were. I love my patients. I love my staff. I like working in underserved communities. I've always worked in the Chinatown community here. I've also worked in Sunset Park, which is made up of largely Hispanic population, and now almost half of them are Chinese as well. Brooklyn has turned out to be one of the largest populations of Chinese, and I speak Spanish and Chinese, so that worked out very well for me. I prefer working in medically underserved areas. It's just where my heart is, having been an immigrant myself. We're accessible 7 days a week. The accessibility of a private practitioner is definitely different from one that is employed, no matter what at the end of the day. They know how to get me. To us, I know it could be like 1 of 20 patients you've seen in that day or 1 in 30, but to that patient, that was their 1 GYN visit or whatever or obstetrical visit. And so I know that with every single encounter, it matters. Every single delivery is different. Every baby is special, and I've never seen an ugly baby. And when you get to make a patient feel better who's been bleeding, who's had pain, and you touch their lives and it's in a positive way, it's all day. So there's reason to come to work every day. We take care of anything that deals with women, anywhere. And it ends up being sometimes a therapy session. Sometimes they're planning for pregnancy, avoiding pregnancy, post-pregnancy. It's the fear of cancer. Sometimes they're bleeding too little, bleeding too much. Anything that afflicts a woman. Sometimes it's menopause, sometimes it's relationships, sometimes it's abuse. On a bad day, we have to talk about their history of abuse. Sometimes it's their own gender choices. It's the gamut. So we're reproductive endocrinology, we're gynecologic oncology, we're high-risk obstetrics. We even take care of some men. Occasionally their spouses, sometimes their partners. When it comes to sexually transmitted diseases or infertility, we deal with the couple.
Thank you. Okay,
Thank you for visiting us today, and I hope that the next time you're in need of an obstetrician gynecologist that you consider coming to our office.